We're going to cover interesting topic of digitalization and its impact into ophthalmology space today. In terms of content, we are going to cover why there is a need for digitalization in ophthalmology, factors driving it. Then we get into a little bit more details in the patient monitoring and smart surgical solutions. We'll talk about the technologies addressing these challenges and issues. We'll talk about certain solutions as well. Then we'll focus a little bit on the commercial and market side by understanding the geographical uptake of different digitalization solutions in ophthalmology. We'll then be getting into recent innovations, understanding how these innovations are converting into opportunities for different players, startups, small and medium enterprises, big players as well. And then finally, something about the future in terms of what do we expect from the near future. As you all understand that digitalization is nothing new to the life sciences space, and it has been transforming the field of ophthalmology as well, and overall eye care, how it is being delivered. Advancements related to digital technologies have led to more accurate diagnosis, overall treatment, and the enhanced patient care as well. And as the population is aging, it is becoming obvious that there would be more chronic ocular conditions like cataract, glaucoma, AMD, and they carry significant healthcare burdens, as well as requires patient time in terms of frequent office visits, clinic visits, etc., and require regular monitoring as well. And the different digital techniques such as OCT have enabled ophthalmologists to obtain high resolution images and provide better diagnosis and overall patient care. Um, Digitalization is also making a significant impact into the overall patient journey and addressing several unmet needs. So as you see on this slide, it is being divided into different sections of the patient journey, starting from patient education and empowerment. So digitalization is making a considerable impact at this stage, where comprehensive information around eye conditions, treatment options available, even preventive measures what patients can take are being provided through different interactive websites, mobile applications, patient portals, which are acting as educational resources, and creating even personalized care plans as well to deliver right patient care and enhance the overall understanding of the condition and promote active participation of the patients into eye care. Let's understand a little bit of breakthrough technologies into the ophthalmology field. Some of them you might be aware of, some of them are newer. Smart contact lenses is something being talked about significantly from various years, but there has been continuous evolution into this space. So smart contact lenses are continuously monitoring important eye parameters such as intraocular pressure, which is crucial for different eye conditions like glaucoma, etc. And these measurements are used to help ophthalmologists take informed decisions, right? And then OCT camera, which is optical coherence tomography, is a non-invasive imaging technique where light waves are used, and OCT provides detailed visualization of the eye structures, aiding healthcare professionals in early detection, precise monitoring, as well as even leading to the better planning of the treatment as well. Then we have uses of AI into fundus cameras, where AI algorithms are making remarkable progress into diagnosing different eye conditions, and large data sets are being used to train the deep learning models, which ultimately can analyze retinal images and detect different type of abnormalities with higher accuracy. So these are just few of them, but we have various other innovations happening into this space. We'll talk about a little bit on the patient monitoring side as well as surgical solutions in the next sections. For that, I'll invite Deepti.
Thank you, Rachit. So, now we'll speak about the emerging patient monitoring and smart surgery solutions in the lens of the ophthalmology. And if we see the categorization of the emerging patient monitoring and smart surgery solutions, is that patient monitoring devices tend to be patient centric devices or clinic centric devices. And some of the few technology solutions that we have seen here that are really upcoming and booming are like ocular assessment or eye disease assessment based on smartphones, video games, contact lenses. And when we see for clinic centric devices, we have seen biomimicry models that are coming up, telehealth management systems are coming up for ophthalmic care, and intraocular lenses which are based on sensing models. For smart surgery devices, we just have clinic centric devices. So as of now, because yes, patient centricity is one of the area that needs to be developed here. But since clinicians and eye care professionals and surgeons intervention is required, so we see that telerobotics, digital microscopy, and super microsurgery being one of the key areas that we see where the ophthalmic devices are really pacing up. Let's see that what is the geographical uptake of digitalization in ophthalmology. How is ophthalmology, especially the digitalization, is taking up in different geographies? And if we see from the lens of the smart surgery, we have known that robotic surgery is one of the leading way where the North America seems to have the highest market, followed by the Europe and Asia. And if we compare the ophthalmic surgery in terms of other surgeries, we have seen that 20% of ophthalmic surgery is devoted in the robotic surgery market. And this market is seen to be growing year on year, and it's going to reach almost multi-million US dollars by 2030. Now, what are the reasons that this market is growing? Is some of the reasons, notable reasons that we have seen, is the advancements in telemedicine and breakthroughs in surgical robots, and there's an increased adoption in surgical robots, especially microbots, nanobots that we have seen. Infrastructure is also definitely one of the role that it's playing in adoption of digitalization in ophthalmology. We also see there is a rising prevalence and growing cases of chronic eye diseases across the various age groups in people. Moving ahead, I would like to invite Rachit to speak about the future prospects of digitalization in ophthalmology.
Thank you, Deepthi, for sharing insights on all these topics, talking about startups and what has been the geographical uptake. So towards the end, we like to cover how the future looks like, which certainly looks promising from the digitalization standpoint. We we expect to see continuous innovation and growth happening into different areas, like virtual care, and health, then digital twins, utilization of metaverse, and obviously significant new innovations in the robotic space. So all of these areas are not new, but we we expect to see different new applications as well as use cases within the ophthalmology space. For example, talking about virtual health is obviously an enabling and revolutionizing the ophthalmology space. Through virtual health, ophthalmologists are able to remotely diagnose, monitor, and treat eye conditions. Digital imaging technologies like OCT is going to make significant impact into again accurate diagnosis and monitoring of retinal diseases. And we also expect that different virtual health platforms would be coming up, which will provide opportunities for patient education and engagement, also allowing also healthcare professionals like ophthalmologists to share educational resources and discuss treatment plans and answer patient queries into more real time. Yeah, which will again increase the adoption as well as awareness about the overall solutions which are available in the on the market for eye care.